All right, guys, just a few moments while I get the YouTube live going. Welcome, everybody. We'll be starting momentarily. Just give me a couple of minutes. Okay, Dr. Hibbert, we are live on both platforms. You can begin when you are ready. It's over to you. Whenever you're ready, we are ready.
All right, excellent. We are ready to go. All right, welcome everyone to another meeting in our monthly seminar series where we come to learn a lot. Before we do anything else, I just want to welcome the Holy Spirit, invite the presence of the Lord in our meeting. And so I'm going to ask Miss Gail Denisha to open in a word of prayer for us.
Okay. Hi, good night, everyone. My name is Denisha Gill. Let me just read a quick verse here for us tonight. So it's taken from 1 Corinthians 10:31, and I'm reading from the God's Word Bible. It says, so whether you eat or drink or whatever you do everything to the glory of God. So whatever we do, we should do it unto the glory of God. So, God, thank you, Jesus. God, we give you praise, we give you honor, we give you glory. For you are worthy of all the praise, you are worthy of all the adoration, oh God. For this is the day that you have made, oh God. Your word said we should rejoice and be glad in it, oh Lord. So, God, we thank you for another seminar, oh God. So, Father God, whatever we learned tonight, oh God, open our minds, Jesus. Open our hearts to receive and learn, oh God, whatever you have planted in your servants here tonight, oh God. Father God, I pray for each and every speaker, oh God. I pray you touch their hearts, touch their mind, oh God. Cover them underneath your blood, oh God, and they're going out and they're coming in, oh God. Build a fence around them, oh Lord. For I pray, oh God, for everyone under the sound of my voice here tonight. I pray, oh God, that you, oh God, will be our guide, our shield, and our butler. Father God, take preeminence over the atmosphere. Take preeminence, oh God, over her lives, oh God, as we leave everything completely into your hands and into your cares. We say, God, have your way in us and through us. As we give you thanks, we give you glory, honor, and praise. In Jesus' almighty name I pray. Amen.
Amen. Amen. Here to give us our official welcome for tonight is Miss Cassandra Monteith. And so I'm going to ask her to do that for us just now before we introduce our first speaker.
Hi, good night, everyone. Good evening. Pleasant good evening to you all. Dr. Hibbert has mentioned welcome, but I'll start with the presenting the official welcome. I just want to welcome you all to this platform. I'm truly excited about this evening's topic, hair and skin. That's my pet peeve. And I have hair issues. So I am so looking forward to it, and I'm sure you are. So as we prepare to dive into the realm of skincare and hair care, just pay attention, enjoy the presentation, and as we share and learn from each other, let's have a good time. Thank you.
Wonderful. Thank you so much, Miss Monteith. I also encourage you to just send the link to others who you know may be interested so that they can come along for the ride and learn with us as well. This evening, we have two speakers, firstly, and we're going to introduce our first speaker for tonight. She was described in a Gleaner article as an optimist who always wears a smile. She's passionate about making people look good and making people feel good, not just on the outside, but on the inside. Thus, leading her to becoming the owner of Bella Day Spa and Shades of Elegance Salon and Spa. She's a consultant trichologist and has been offering her services to disadvantaged girls at Mary's Child and Yadel Home for Girls through total makeovers, procedures that involve doing their hair and treating their faces and nails. In addition to that, she wears many hats, namely President of the South St. Catherine Chamber of Commerce, Justice of the Peace, and Skills Trainer. This evening, she's here to teach us about nurturing healthy skin, hair, and scalp. Please make welcome our very first presenter, Miss Trisha Reed. Over to you, Trisha.
Hi, good evening, everyone. And I must say, thank you very much for that introduction, Dr. Hibbert. I really, really appreciate it. And I must say thank you very much for inviting me on this prestigious platform. I am elated to be here this evening. Now, when we think about skin, I don't know what we think about, but tonight I am here to educate and to teach you about what skin is all about, also your hair and your scalp. I know for a fact that many of us sometimes, wonder and we do the incorrect things. So we don't know how to go about treating for our skin, treating for our hair types. So tonight I am going to be, elaborating on how to take care of and also to tell you, how we should accept what we have working with as our personal. So no further ado, we're going to go right into it. So the topic is nurturing a healthy skin, hair, and scalp. Now, when we think about our skin, what do we think about? How do we view our skin? Is it that we are wondering, what is skin? What are some of the functions of the skin? Am I doing the correct things? Am I using the right products? All right, so let me bring your skin to your attention. Now, our skin is known as our body's defender. It is the largest organ on our body. It plays a vital role in safeguarding from external factors such as, we have pollution, we have pollution, and for example, if we have any abrasions, any cuts, it protects the body from contracting bacteria or anything like that. Now, understanding the significance of skin and its health, the skin serves as a protection. It serves as protection. It helps to regulate the body temperature. It's a sensory nerve as well. So the skin helps us to know, understand touch, how it is that we are, when somebody touches us, we know exactly, that, yeah, somebody is next to us. We just got a touch. So based on that, the skin is very, very important. So next slide, please. All right, so next slide. All right, so we're going to be unveiling the layers of the skin. Now, the skin has 3 different layers. We have our epidermal layer, which is the outermost protective layer. And then we have our dermis, the epidermal layer. The epidermal layer houses blood vessels, nerves, and hair follicles. And then we have our subcutaneous layer, which stores fat and maintain body temperature. Now, as you can see, the top layer where the hairs are coming from the skin, hair is an appendage of the skin. Further in our presentation, we'll show you the correlation between hair and skin, but hair and skin goes hand in hand because, as I said, hair is an appendage of the skin. Hence, we have to get knowledge of both together. Next slide. All right, so we have different skin types. And I will say that we are wonderfully made by the Lord. When we were being created, God thought of everything. He gave us even different skin types to work with. So we have 5 different skin types. We have the normal skin, we have dry skin, we have oily skin, we have combination skin, we also have sensitive skin. Now, how do we identify our different skin types? The normal skin, as it says, normal. It doesn't feel tight, it doesn't feel oily, it feels normal. We have dry skin, which always feels tight, especially after a shower or just washing your face without putting any moisturizer on or any oils at all. The skin will always feels dry. Now, the oily skin always feels oily. And guys, I must tell you this because this point is very, very important for me to, share with you. I know a lot of times we complain about oily skin when our skin is oily. Oily skin is one of the best skin we can ever have. And reasons for that is oily skin, we tend to age less. We don't age as quickly as persons who have dry skin or sensitive skin. Also, when we get a spot or a scar or hyperpigmentation, the skin can heal itself quicker. So the skin does not hold on to spots once you have oily skin. I mean, oily skin, you don't get fine lines and wrinkles as easily as for someone who has dry skin or say a sensitive skin. So if you are someone out there and your skin is oily, don't go around and purchase products that will dry the skin out, because what you're doing, you're further damaging your skin. Preserve the oils in your skin. And the reason why oily skin is one of the most important skin is that the amount of oil that is being produced from the sebaceous glands, it protects the skin, and the skin maintain its suppleness, its moisture. So the skin always look glowy, dewy, and exciting. So maintain it. Maintain the oily skin. Now we have combination skin, and as the name's combination suggests, combination, it feels a little oily, it will feel a little dry, and it will be a little bit sensitive. It just depends on the different combination. It can be a combination of all 5 skin types. And then we have our, last but not least, our sensitive skin. The sensitive skin may be itchy at times. It has a lot of redness. It feels tight, it patchy, and it also stingy. Anything you use on your skin, it stings. That is sensitive skin. All right, so we are going to go into the different concerns of, what our skin may hold. Like, for example, the different skin concerns. We have acne, we have hyperpigmentation, we have aging skin, we have premature aging, and we have hyperpigmentation. So the slide that you're looking at now are 2 different skin conditions. We have hyperpigmentation is there, and we have acne. We're first going to look at hyperpigmentation, right? Now, hyperpigmentation occurs due to sun exposure, like excess sun exposure. Certain medications will allow you to have hyperpigmentation. Pregnancy will allow you to have hyperpigmentation. Also, some health conditions such as Addison's disease and PCOS, which is polycystic ovary syndrome. A lot of persons suffers from PCOS, and PCOS will produce pigmentation in your skin. All right, so next we have the acne. Sun exposure as well can cause hyperpigmentation, over sun exposure without using a sunscreen. All right, so we have acne. Acne can cause from a lot of different stuff. So for example, PCOS again can influence acne. PCOS is one of the most predominant factor for acne now. And I find that a lot of young persons are suffering from PCOS. Also, acne, you from overproduction of oils from the sebaceous glands. That is one of the reasons why we have severe acne. Also, over exfoliation can cause severe acne of the skin. Not just over exfoliation, but bleaching. Bleaching is one of the another dominant factors of producing acne on our skin. Now, regular acne is when our pores are clogged. Sometimes we don't tend to spend time on our skin. So because we don't spend time on our skin, our pores become clogged. Because we're not exfoliating. 2, we're not using any cleansers or any moisturizers on our skin. So because we're not paying attention to the skin, the pores become clogged. And I must tell you that everything needs to be exfoliated at some point in time, just as we go to the dentist every 6 months to get our teeth clean and plaque. And I must say to you guys that principles don't change. Principles apply right across the board. So get your skin exfoliated once in a while, all right? Another common skin concern we have is eczema. Now, eczematic condition skin, it comes in many vast arrays of eczema. You have psoriasis, you have dermatitis, and you have the plain eczema, but all of them are one family. Now, eczema act up on the skin, medication, it depending on the climate condition. If the time is too hot, some persons' eczema will trigger. If the time is too cold, some persons' eczema, it just depends on what triggers your eczematic condition. Also, food that we eat. If it is that we eat cheese, we have a lot of dairy, you know that we will have a breakout in eczema. If it is that you're allergic to dairy products. All right, aging. premature aging. Premature aging can cause from a lot of external factors as well as a lot of internal factors. So some of the external factors, again, the products that we use for persons who are out there who are bleaching their skin, in another 10 years, we are going to have a catastrophe of skin cancer because the hydroquinone is very harsh on the skin. It is very, very harsh, and it is very damaging to the skin. What it does, it exfoliates the epidermal layer. Remember that the epidermal layer protects the dermal layer from the sun rays. Now, the skin serves as a protective layer, right, from the sun. Now, UVA is one of the most damaging ray of the sun. We have UVA, UVB, but UVA is really what we are more concerned about, right? And if it is that we're going to be using the hydroquinone, all we're doing, we're damaging and stripping off the epidermal layer from the skin. So that's something that we need to look into. It causes premature aging. If it is that we're exfoliating too, like some people scrub their skin every single day. No, we can't do that, because what we're doing, we are taking away the integrity from the skin. We're killing the elasticity in the skin. So oftentimes our skin drag. We look, our skin looks drag. It's because of what we're doing. So that what we're doing to the skin to allow us to, you know, be more aged, and the way how we massage our skin as well. We can go to the next slide, please. All right, so we spoke about pregnancy, and we spoke about hormonal imbalance. Hormonal imbalance can cause, acne, can cause overproduction of sebum. It can allow you to have hyperpigmentation. It can allow you to be, darker. It can allow you to be lighter. It just depends on the severity of what the hormone, what imbalance are you facing. No, and what I should tell you too is that the endocrine system is really important to us in terms of our hair and our skin. That's where all the action takes place, in the endocrine system, as it relates to your skin and your hair, as it relates to how your skin looks, as it relates. So if it is that our hormone is off, then we're going to have symptoms occurring on either the hair or the scalp. So a lot of times what we eat, what we do internally, it affects us externally. So we need to look at, you know, how we eat, how we exercise, the importance of dieting. And this is what this group is all about, how we eat, how we take care of ourselves. Pregnancy, again, remember, as I said, the endocrine system is where all of the changes takes place in the body. So the endocrine system is where we have the reproductive glands, and pregnancy, once you're pregnant, the body is going to be off to facilitate the pregnancy. So in pregnancy, we produce more progesterone. And once we produce more progesterone, the estrogen level is going to be on the lower side, because we need progesterone to facilitate the baby. Now, when we are pregnant and our body is producing more progesterone, what happens now is that, one, we can have a breakout in acne, our hair can go, our skin texture change, the color of our skin change. So once you're pregnant and you realize that a lot of different things are happening, don't be too concerned. Just wait until we have that baby. Sometimes we are pregnant and our skin start to change. We're having the acne and we go to the doctor and we start taking this, we start rubbing. No, it won't help. Just go through the process of carrying your baby for the 9 months, and then you start to treat your skin after. All right, so bear all of that in mind. All right, as I said before, this sun does take 80% of aging is caused from over sun exposure. So if it is that we're going to be in the sun, I recommend sunblock every day, every day, because we have to protect our skin from the rays of the sun, UVA, which is that comes out on us. It comes directly, penetrates directly on the skin. Now, what we recommend to prevent, we need to use our sunblock, and I don't know how much minutes each of you skin takes before, how many minutes worth of sun you can take before the skin starts damage, but each and every one of us has a specific timing of how long the body can guard itself against sunburn. So everybody has a time limit, like a 20 minutes or a 30 minutes. Now, what the sunblock does, it gives you additional timing before you start getting burned. So you can't put on your sunblock 8 o'clock in the morning and extend the sun till 5 o'clock in the evening or 9 o'clock in the night and expect that you're going to get full coverage. No. Walk with your sunblock in your bag, apply a little, maybe every 3 hours, apply a little. And remember that the hardest sun is between 10 a.m. and 4 p.m. That sun is one of the most dangerous sun. So we need to avoid that sun as best as we can. No, sun has its advantages and it has its disadvantages. You know, the advantages of the sun is that we need the vitamin D. We need serotonin in our brain to help us to function, but we still need to protect the skin against aging. And one of the things that I want you to understand is that females, we start aging at age 30. For the males, we start aging at age 20. They start aging at age 25. And females that are on the platform now, I don't know, but the males always seem to have an upper hand from us because we have everything that cause us to, be on the more problematic side. We have everything to deal with on the problematic side. So men has 5 years, 5 year span longer than us. So if it is that we're over 30, we need to start using our anti-aging products. All right. So remember, 80% of premature aging starts from overexposure in the sun. Also, aging too can be a result of us neglecting our skin, not taking care of our skin, just thinking that, oh, take the skin for granted. No, our skin serves to adorn and protect. So we need to protect the skin. We need to ensure that we give the skin what it needs in order for our skin to glow with us and smile back at us. All right. So please avoid the sun as much as you can, especially the sun from 10 till 4 in the afternoons. All right, so the next slide we will be talking about skin routines and exfoliation. So this is what exfoliation would do for your skin. For exfoliation is cleaning the skin, giving the skin a deep clean. It's the process of removing dead skin cells from the surface of your skin using we can use natural products to exfoliate, and we can also use chemical products, and we can also use a tool to exfoliate the skin. Now, some of the benefits that we have, and you can look at her skin before. She had a lot of rough skin. She had a lot of built up. She had a lot of debris. And then after you realize the skin is glowing, it is smiling. Now, what she did, we use a tool to do her exfoliation, which was microdermabrasion. Now, we can use an array of different products to exfoliate the skin. And as I said, we can't exfoliate every day. We can exfoliate once in a while, deep exfoliation. Like regular exfoliation, you use your sugars or your cornmeal or your scrubs, you can do that maybe once every 2 weeks. You go in, or even once per month. You can use your cornmeal, or depending on the skin type that you have, then we will choose the product for exfoliation. So first you need to find out the type of skin that you have, then we can recommend the different products that we need. And you have homemade products as well that you can use to exfoliate the skin. I'll definitely go into some of the exfoliating products that we have and some of the benefits. So what I'll do, I'll just go through the different skin types, how to care. So for normal skin, we need to maintain the balance in the normal skin. So we need to maintain the oil production. We don't need to use anything that is going to dry out the skin. We don't need to use anything that is going to make the skin too oily. So as it says, normal skin. So, we need to cleanse as a routine, and this is a routine that I'll be giving you. We need to cleanse, tone, and moisturize every single day, morning and evening. Now, what you can do is, and this is for all skin types, so I won't repeat. This is just for all skin types. So for at night, remember, we would have been out there in the grease and the dirt and the sun for the entire day. So I recommend that you cleanse your face every night. And cleansing your face, don't just do this and then go. Take 1 minute out of your evening, just 1 minute, and cleanse your face. So you set your clock, take 1 minute to cleanse your face every single evening. In the mornings, you really don't have to cleanse again, because one, your cells regenerate every night while you're sleeping. So in the morning, you would have a nice glowy, dewy look. So what you would need to do now is to wash with water, because you don't want to strip the skin of its natural oil. So you would already strip enough the night before. So you now allow the skin to reproduce, to maintain the skin throughout the day. And then you go back and cleanse in the night. So you would use your cleanser every night, your moisturizer, your night creams, and that is based on the skin type that you have. Now you can use your citric acid products. You can use your lime at home, whatever it is. But as I said, know your skin type before you start choosing your different products. Next slide. So for dry skin, you need to use products that are for dry skin. So, all right, so the oily skin is on the screen now. Oily skin is on the screen now. So we'll work with oily skin. So what we will do is to focus on managing the oil. So if it is that we have oily skin, remember, as I said initially, don't use products that has a lot of alcohol, or that has a lot of salicylic acid, or that has a lot of coal tar, or anything that is going to cause drying out, because you want to maintain the oil in your skin, right? So you need to use products that is going to minimize the oil production, all right? So as I said before, cleanse night, and for persons who have oily skin, and if it is that you really need to clean in the mornings, then you can go ahead. But if it is that you're not that oily, then don't cleanse in the morning. Just use your water and wash and apply your moisturizers. And also, if it is that you're too oily, then you don't use a moisturizer in the days, but use your sunblock, because oftentimes the sunblock has in a lot of moisture, because you don't want to be too oily, all right? So for the next slide, which is dry skin, no, this is a skin that we need to work hard on. We need to work hard on this skin. And as you can see the diagram, it's cracky, it's rough, it doesn't look good. So for persons who have dry skin, we need to definitely go into that skin. Use a lot of moisturizing products. Use your cleansers that is going to break up that skin in terms of penetrating the skin. What we normally recommend is, first of all, products that doesn't have in too much hydrolyzed moisturizer, products that can penetrate. So like some persons would use oils. I don't recommend that you use too much oil, because one, the molecules in the oil is too big to penetrate the skin. So we need to use products that are hydrolyzed so that it can push into the skin, right? So for us, for dry skin, we need to use products that is going to infuse moisture in the skin readily and easily. Sometimes we use the oil and the oil sits on the skin, and once we go outside, the dirt and the dust that blow and it logged onto the skin, and then that can cause us to have acne and problematic skin. So we have to be careful of what we do and how we do it. All right, so we normally, for dry skin, we need to use a lot of serums serums are very good, because the serums are lighter. They're not that heavy. They will penetrate the skin. So you have a nice, soft, glowy feel. We can use avocado as well, because avocado is very rich in moisture. So for combination skin. No man, we can go ahead. For combination skin, as the name suggests, combination, we would have 2 different skin types. So for most times though, the combination skin, the T-zone area is very oily and then the outer perimeter is very dry. So for those persons with the dry outer perimeter and the T-zone being oily, so you can use 2 different products to cleanse, or you can go in with a sensitive cleanser. What the sensitive cleanser will do is to balance, because the sensitive cleanser is not too harsh. It's very mild. So you can mix your sensitive products for the combination skin. Now, if it is that you have a little acne, then we need to know, what is causing the acne. Is it the acne from the food that we eat? Is it acne from PCOS? Is it acne from medication? Because oftentimes medication push side effects, it push up acne. All right. So again, know your skin type. And every skin type, you need your skin routine. For every skin type, you need to cleanse, tone, and moisturize every single day. And you can do a mask maybe once a month. You do a mask, and the mask must be depending on your skin type, because you have masks out there that is moisturizing, you have masks that will dry out, and you have masks that will maintain. Now, for persons who are, I mentioned the avocado just now, for persons who we can make our own home remedy with the pear, and that will help to send moisture into the skin. Now, for sensitive skin, you notice the redness, the itchiness, the burning. We can't use anything that has in the alcohol or the salicylic acid. We have to use products that are very, very, very mild on the sensitive skin. All right, so before we get into our hair, I just want to go in a little on the benefits of exfoliation and some of the stuff that we need to exfoliate the skin. So for example, exfoliation, we can use a chemical, we can use our glycolic acids. Like for professional products, we use our glycolic acid, we use our salicylic acids, and that is dependent on the skin type. So if the person is suffering from severe acne, then we would definitely go in with our salicylic peels. For persons with anti-aging, we will definitely go in with our glycolic acid and our hyaluronic acids. Those acids help to reduce fine line and wrinkles, and it also helps to infuse moisture in the skin. So like our glycolic acid for persons with dry skin and they're aging, we can use the glycolic acid and the hyaluronic acid to help to smooth out the surface of the skin. And we mentioned the microdermabrasion, and we showed you how the microdermabrasion would help for the skin to look glowy. Some of the benefits of exfoliation is that it leaves your skin looking brighter at all times. It improves the effectiveness of a topical skincare product. It makes your skin looks dewy and glowy. It enhances absorption. When we do an exfoliation, it helps the product to absorb into the skin better, because sometimes the skin is so clogged, it can't absorb anything. Because guess what? We can't put clothes on a dirty body. We definitely have to bathe and feel clean before we can dress up and really feel good. You understand? So as I said, principles don't change. All right. It also helps with long-term exfoliating. Exfoliation helps with long-term increase of collagen production. So that is it for the skin. Now we're going to go into hair care in a jiffy. And as I said before, hair is an appendage of the skin, and hair serves for adornment and protection. The hair strand, one of the hair strand, this hair is divided into 2 main areas. We have the scalp and we have the shaft. Now, the hair shaft has one of the hair strand is divided into 3 different areas. We have the cuticle, the cortex, and the medulla. Now, the cuticle is the outermost layer, and the cortex is the inner layer, and the medulla is the innermost layer, and the medulla is where the color, the pigments are in the hair. So for persons who would have red hair naturally or brown hair naturally, it's in the medulla you find the melanin and all of that. All right. So we have 3 different layers on the hair shaft. No, the hair has 3 different cycles. We have 4 different growth cycles for the hair. We have our anagen phase, our telogen phase, our catagen phase, and our exogen phase. So the hair goes in cycle. So the hair sheds, it grows, it rests, and it starts growing again. So that's the phase. So sometimes we find that our hair is shedding and we think that the hair is breaking, and then we start to panic, and then we call our stylist or your hairdresser or your doctor, say, my hair. No. Sometimes the hair is breaking, yes, but most times the hair is really shedding. And just as though we have our monthly cycle, the hair has its cycle as well. All right, so this is what a hair, one strand of hair looks like under a microscope. So you see the healthy hair and you see the damaged hair. As you can see, as I described, the cuticle scales. So this is what the cuticle scales look like. So when the cuticle is damaged, when the hair is damaged, the cuticle scale will lift up and it feels coarse, and that's when it gets matted and it's get dry, and you wonder, oh, my hair is so dry, and my hair this. It's really because your cuticle scales are lifted, the hair is porous, and the hair can't, absorb the moisture because the porosity is so low or so high, and then the hair starts to break. Now, when the hair is in this condition, we need to look at the other side, which is my right, which should be your left. We would work on the hair to bring it back to this smooth cuticle hair. I just love to look at a hair strand underneath the microscope. So this is really what the hair strand look like underneath the microscope. Just one of the strands. All right, so we have different hair types. So we have texture, we have different textures, and we have different hair types. Now we have 27 different texture, right? You have fine, coarse, and medium. But from that 3 different texture, fine, coarse, and medium, then we have medium fine, medium coarse, medium fine fine. Then you have coarse coarse, medium coarse, and then fine coarse. So each texture has a different version or a different level of fineness, coarseness, or medium texture, right? And then we have different hair types. So remember, hair has 27 different texture. But from that 27 different texture, it starts from 3. So the 3 main texture is fine, medium, and coarse. And then it goes into the different variation of texture. Now we have hair type. We have curly, we have straight, we have wavy, and we have kinky. And now we are learning of C type and B type, and it's basically the same thing. But we have it's curly, straight, wavy, and kinky coily. All right, so those are the different hair types that we have. All right, so for porosity is the ability of the hair to absorb and retain moisture. So if it is that you wet your hair and you realize that water is just dripping, then the hair, the cuticles are so tight that the moisture cannot penetrate the cuticle scale. So we as the stylist would now go into the hair and kind of balance it, because it can't be too open and it can't be too tight. The cuticle scales can't be too tight and it can't be too open. So usually when you go to the salon, you're supposed to get a porosity test done before any chemical service. And oftentimes clients will come in and say that, their scalp burned and the scalp is irritating. Ladies and gentlemen, relaxers wasn't made to burn the scalp, and relaxers was made to relax the hair and not scalp. So if it is that you're feeling irritation, then something is wrong with your scalp. And 2, if it is that you're going to be doing a relaxer, you cannot drink a warm soup before the relaxer, and you cannot drink a hot cup of tea, or you can't wear a hat in the sun to come to the salon to expect to get a chemical service done. Because what you're going to be doing is open up the pores. So we are going to be putting that chemical. It's going to burn easily. It's going to burn same time. So you can't do that. All right. It's going to irritate. So this is understand the porosity of the hair and the different levels and how products absorb into the skin and the chemicals that we use. Now, the skin and the scalp measures 4.5 to 5.5 on the pH scale. So the hair and scalp should be 4.5 to 5.5. So if you're using a product that is 8 on the pH scale, then you're in trouble. And if you're using a product that is 9, you can use that product that is 9, but you need to bring it right back down after. Bring it right back down to 4.5 to 5.5. All right? Because if you leave it up there, the hair is going to break. The cuticle scales are just going to open poofy, and then the hair will get dry and brittle, and the hair will just start to break. So we can't do that. And guys, I'm going to emphasize, take care of your hair. Your hair is your beauty. Your skin is all you have. The Lord lent us our skin, our hair, and our being. We need to protect it. We are borrowed. We don't own ourselves. We are borrowed. So we need to take care of it. We need to take time. Just as though we invest into school and the car and the house, you need to invest in self, because without self, we can't achieve anything. All right. So please invest in your skin and your hair and scalp. So the moisture, porosity and moisture factor. So as I already went through this, so we can move to the next slide. So we have some common concerns that affects the hair now, just as though we had concern that affects the face and the skin. And guys, I must tell you, I'm not wearing any makeup, and I decided not to put on any makeup this evening for this presentation because I want you all to see that.
Patricia.
Yes. I want you all to see that we have to work on our skin. So we don't have to wear makeup every single day, right? So this is the result of me not wearing any makeup for you tonight. This is all my skin. All right, so recognizing traction alopecia is caused from braiding, traction, tightness, ponytails. If it is that you are continuously wearing these hairstyles, this will be the result. Once you notice that your hair is, you're receding hairline and you're breaking, the hair is coming out, then you need to stop. Rest the hair. Find your trichologist. Find your dermatologist. Find your stylist. Find your salon, because it can't be that you're going to be continuing to putting in braids and the hair is looking like this. All right, so you need to stop immediately and start to take care of your skin, of your hair. I'm sorry. Now we have alopecia areata. Alopecia is now common. We are seeing it more and more every day. It is an autoimmune disorder and it is triggered by stress. And I will reiterate every day, we have to take care of us. Because if we don't, then the environment is going to do it for us. All right. So this is what alopecia areata looks like. And you don't have any treatment for it. What we can do, though, is to assist with you balancing your stress life. And also we, as the trichologist, can use, recommend topicals and recommend different things like nutritional base and topical base to assist. But usually, once you are less stressed, it will come back on its own. That's alopecia areata. Next slide. All right, so we have diffuse hair loss. Diffuse hair loss is caused from a number of things. It can cause from medication, it can cause from pregnancy, it can cause from crash diet. And Dr. Thomas can elaborate on crash diet when he's doing his presentation. Once you change your diet, suddenly the hair can shed, because what you're doing, you're telling your hair that, hey, I'm not doing this anymore. The food, our hair gets food from the blood. The blood consists of protein and iron. Now the hair is made up of protein and iron. So if you rob the body from protein and iron, then you're going to rob the hair of its nutrients. And also our major organs take away all the nutrients from the hair and the skin. The hair and the skin get the least amount of nutrients. So we have to supplement. If we want healthy hair and skin and scalp, then we have to supplement in order to achieve healthy hair and scalp. All right, so we now have to, again, stress, crash diet, ensure that we are less stressed, ensure that we exercise, ensure that we are massaging the scalp and stuff like that. All right, so we have another one, which is common. I think this is our final slide, is androgenetic alopecia. Androgenetic alopecia, as it says, it's genetic. It's from your father, your grandmother, your great-great-grand. If it is that you are in that bloodline, it oftentimes one person from your family will acquire this disorder. So sometimes you will come and say, but my brother and my sister, them not have it. So I don't think it's that. But yes, your brother and your sister don't have it, but you are the one who inherited it. So it is something that you inherit, and it is triggered by genetic predisposition, as I said, an immune reaction to androgen. So we know, yes, it's our immune reaction to androgen. So yes, we can slow it down by treating, blocking DHT, and that's an hormone as well. DHT is an hormone. So we can, as the trichologist, do that. All right, psoriasis. Psoriasis is another one which is bad. Psoriasis is, it takes over your body. If you don't recognize and care for it, it will take over your entire body. It oftentimes shows on the hair, the scalp, it comes down in your face, and then it will show on the elbows and on the knees, the rougher areas of your body. And that's psoriasis. Psoriasis is also an autoimmune condition that you have to, watch. It's autoimmune is your own body is fighting against your own body. Your cells are fighting against the follicles of the body. So the hair will have a negative reaction. So as we wrap up, we must prioritize our hair, skin, and scalp. We have to take care. We have to take time out to look at our hair, to analyze our hair, to assess, to carry out the right routines on a daily basis. And just as how we exfoliate the skin, we exfoliate the scalp as well. We need to exfoliate the scalp for the scalp to breathe, for new hair to regenerate on a daily basis. So exfoliation, you can exfoliate maybe once every 2 months or 3 months. It just depends on what you're experiencing. So guys, remember, self-care is important, and I will recommend that you love yourself, pay attention to yourself, love others, take care of you, manage your stress, and be blessed. Thank you.
Amen. It's a wonderful note to end on. If we don't take away anything else from the presentation, please invest in your skin, your hair, and your scalp. I'm going to ask Denise before we continue to just mute your mic for me, please. Denise, thank you. All right. So I know that a number of people have questions for Trisha, but what we will do is we will hold those questions until the end, and we'll have our question and answer segment. So at this time, we are going to go into our second presentation. And our second presenter needs no introduction at all, because he is a highly accomplished physician who has appeared on various radio and television programs, has written and contributed to over 100 newspaper and magazine articles on health, and of late has solidified himself as a TikTok influencer. He's a certified functional medicine practitioner who practices integrative medicine. He's the founder of Thomas Medical Center and is passionate about transforming lives for the better. Dr. Thomas not only dreams up ideas of how to make his patients' lives better, but he finds ways to make those dreams a reality. One of those dreams led to the creation of the Be Healthy Family Group, which was curated to help his patients develop healthy habits in a fun and sustainable way through community connection. His most recent dream becoming a reality is his 14-day flat belly challenge that has impacted patients all over the world. If you miss this cohort, look out for the next, as this challenge can change your life. That's a shameless plug for Dr. Thomas. This evening, he will be educating us on homemade skin and hair care. So please help me make welcome Dr. Orlando Thomas.
Hi, everyone. Good night. I want to thank Dr. Hibbert for, yes, that shameless plug. And I want to say welcome to everybody who is joining tonight to hear about their skin and hair, something that I'm traditionally not known to be very interested in, but having visited Shade of Elegance maybe last year and had a facial done and having a conversation with one of the technicians there, I became quite fascinated about research into my skin and how to take care of it better and how to enhance how my skin looks. Give me a sec. I'm trying to get my slides up and running here. Just give me a sec. So yeah, so the other presenter tonight, Trisha, her staff is the one that really inspired my interest in this area more than anybody else. And so, you know, over the last, say, 12 months, I've been looking into this area, researching. But, you know, also I found out that there was a member of my household who was way ahead of me, who had been researching significantly in this area and has made significant advancement in her understanding and her use of skincare and hair care products. And so for this presentation, I had to draw on her expertise to help me prepare this presentation. So most of the slides you'll be seeing are actually done by none other than Annabelle Thomas, my 15-year-old daughter. And, you know, this is her and daddy in a number of scenarios. So whenever I am going on any little adventure or any excursion externally, so you see me and her at champs, me and her just finishing a 5K, and me and her there at the highest point on the highest mountain in Jamaica. So yeah, so she is very shy, you know, in terms of coming on to present. So she will not be presenting tonight. She'll just be listening in. And so a lot of the slides you'll be seeing will be actually her work and being presented by me. Now we're gonna look through a number of different areas of skin and hair care, specifically looking at homemade products and simple routines that you can use to take care of your skin. So skin and hair care doesn't need to be a financial burden and doesn't need to be an additional way that you harm your health. For many persons, it actually is, as Trisha just told you. There are many areas in which me and Trisha do agree on skin and hair care. She's the expert here, but there are a couple of areas in which we do not agree. And so being the host and being the one who invited her, I'm going to be very gracious while I try to, you know, register where me and her might differ on a couple issues that she mentioned. Now, the perspective that I want to look at skin from is just a layer on top of what Trisha did. Trisha gave you a beautiful picture of the anatomy of the skin, and she did explain the different appendages and the different layers, beautifully done. But in addition to what she said, there's another important aspect of the skin that I want to touch on, and that is the whole idea of the skin microbiome. So the microbiome is a terminology that is a general term that refers to the bacteria and the fungus and viruses, the whole microorganism climate that, you know, occurs in a particular part of the body. So typically, when we use the term microbiome, we'll be talking about the intestine and the gut. And you've heard me talk about that as being the basis of much of the health and disease that we enjoy or suffer from. But we also know that the mouth and the eyes and the skin have its own microbiome, its own set of bacteria that actually live there, that actually help to maintain that barrier that Trisha spoke about, help to maintain the health of the skin. And also, in many instances, if it's out of sync, may cause diseases. So Trisha did mention that bacteria on the skin may contribute to acne. And yes, that's a big area. Bacteria on the skin can make your skin look healthy or make it look diseased. And what you put on your skin does affect the bacteria of your skin, the types and quantities, the harmful ones as opposed to the beneficial ones. And so this evening's talk would be basically geared at what are we doing to harm the bacterial load on your skin and in your pores and in your hair follicles, in your sebaceous gland, and what can we do to restore the bacteria and thus give healthy skin. This area of research is in its infancy, it's not well established, but traditional medical doctors in the area of homeopathy and naturopathy and more natural skincare practitioners have loads of experience and lots of testimonies and lots of anecdotal data to back up that if we have a healthy skin bacteria, you can have a healthy skin. And much of modern technology and skincare ignores the fact that there is a healthy skin bacteria and actually do more harm than good. And so I'm going to try to, shift your mind and help you to understand that this is an important aspect of your skin. So as you see here in this picture, each area of the skin, the epidermis, moist areas like on your armpit and in your groin, and oily areas, they have different types of bacteria. So the same microbiome in your palms and your soles is different from what's on the back of your hand. It's different from what's under your armpit and gives different types of skin composition and different skin textures and different skin odors. And so you got to respect different types of bacteria on your skin. Also, we know that when your skin microbiome is weakened, it's gonna cause excessive loss of water and dry your skin out. It's gonna weaken the barrier, so you're gonna get skin infections and acne. It worsens your psoriasis, which actually is an autoimmune disease. But when you have a healthy microbiome, it actually helps you to have a healthier skin. So this is particularly important. So I want to call out a lot of these skincare products that people put on their skin with these chemicals that they contain, which do a lot of harm. In the short term, I must admit some of these things make your skin look shiny and pretty and may feel a little supple in the short term, make your skin look clean. But in the medium to long term, they will cause damage to your skin. And so most of the chemicals that are on the market are not fit for skin use. And I need to add another layer to that is whatever you put in your skin, you need to understand is going to be absorbed into your body, into your bloodstream. It's not lost on you or me that many medicines that we use, such as painkillers that are topical, don't work to reduce pain in the skin. You apply them to the skin and a few hours later, your pain is gone because they're absorbed into your skin. There are lots of chemicals that farmers use, and I become a farmer now, and you'll see on the label that if you come in contact with this chemical on your skin, you should visit the doctor immediately and wash with water for half an hour, because the skin is an organ that is very absorptive, and fat and alcohol-based nutrients and chemicals are going to be absorbed into your skin, and you're going to find these chemicals in your bloodstream a few hours later. So if you look on the bottle of your lotion or your perfume and see the chemicals in them, when you use them on your skin, they're getting into your blood, into your liver, your kidney, your organs, into your brain. And is that something that you really want to be doing day in, day out? Do you really want to be putting, chemicals that are known carcinogens, even in minute amounts, on your skin day after day? That's something that I think is, if you think about it, you might not want to do. So that's the the perspective I'm coming to you from. Give me 1 second. And my battery on my laptop is dying. Let me just plug it in as I move to my next slide here. And so here are a few ingredients, guys, that often occur in skincare products. And I want to take a picture of this slide and you know, and keep it. And if you want, if you're in a WhatsApp group, I'll send this presentation to your WhatsApp group. So these are chemicals that are found in common skincare products. So most colorings, FDCD color pigments in skincare products and in hair care products, right, that dye your hair are harmful chemicals. Even if they're in small amounts, bioaccumulation occurs and they're going to cause problems. Lots of hair care products, you know, dyes are going to cause allergic reactions, various reactions. I've treated multiple patients for these things, right? And so you want to be careful. Polyethylene glycol is a very common agent used in skin moisturizers, which is actually antifreeze. It's something that we use to prevent the gas in motor vehicles from hardening up in the wintertime. And it finds itself in many foods and in many skincare and hair care products. You know, hydroquinone, which Trisha mentioned, was one of those bleaching agents, and various steroids. It's a very, very damaging chemical that damages your skin. And it's used, if you see a chemical marked toner, to make your skin tone improves and make it lighter. It's going to contain hydroquinone or some steroid. That's what is always used. Don't use those things on your skin. They're going to damage you. They're going to damage you. Urea and various forms of its derivatives is also another chemical that you should avoid because they are damaging to your skin. Sodium lauryl sulfate, very, very common in toothpaste, and it's a very common product in lotions and various things that you put on your skin. So if you look through your bottles of chemicals that you put on your skin, you'll see all these chemicals, and they will be damaging to your skin and overall health. Synthetic fragrances. If you see the word fragrance, that's like a possibility of over 200 different man-made chemicals that will give you a scent that is pleasing, but they are hormone disruptors, they are cancer-causing agents, and they are going to age your skin faster as they contain free radicals. And parabens, for example, parabens are commonly used to preserve many of your skincare products, make them last longer and remain stable at room temperature. Parabens are known cancer causation chemicals fingered in many breast cancers that possibly contribute in their hormone disruptors in terms of many of your hormone imbalances, not the least of which is your thyroid problems and your PCOS problems. So skincare, for the most of us, is gonna be a whole host of harmful chemicals that we are putting on our skin in an attempt to get outward beauty while they are damaging our insides, just to put it mildly. Yeah, so I'm gonna kind of go through this kind of routine of, you know, what do we do for our skin to make them, you know, clean and healthy. And I'm gonna be using natural chemicals to give you ideas of how you can, you know, cleanse, exfoliate, moisturize, and hydrate your skin and protect it from the different elements in nature that may harm your skin. No, I'm not gonna follow this didactically, but in terms of cleansing your skin, you know, one thing that I will say across the board, and most people who study skin will tell you this: most soaps and detergents are gonna damage your skin, right? Most soaps are, as Trisha hinted, are gonna be a pH of that's an alkaline pH 9, 8, 9, 10, and that's not where your skin should be. That's not where your hair should be. Your hair and skin should be slightly acidic, and these chemicals are highly alkaline. pH is very high, and they cause damage to your skin. You also see, you know, many soaps will claim that they kill 99% of bacteria on your skin, and they sell that to you as a good thing. That's rubbish, guys. You don't want to kill 99% of bacteria on your skin. 99% of bacteria in your skin are actually good for your skin. They're actually good bacteria. And if you kill them off, you're going to make your skin less healthy. So using soaps on your skin is going to be a problem. And that's not the most healthy way to take care of your skin. Actually, using a small amount of coconut oil or, jojoba oil or olive oil on a piece of, linen with a little texture to it, with a little warm water, and using that to cleanse your face is probably all most of you ever need. You don't need soap, and most soaps are too harsh and damaging and dry your skin and damage your good bacteria. So to clean your skin, it's probably not as complicated as you might want to think. Your skin is supposed to have oils. The dead skin cells are not all supposed to go all the time. Your bacteria on your skin feed off the dead cells. So you don't want to be getting rid of everything. As Trisha said, you don't want to be exfoliating every day. That's not good for you. Another good way to cleanse your skin is using aloe vera with a little bit of honey and a few drops of essential oils. And essential oils, guys, come in various types. You have lavender, you have chamomile, you have eucalyptus, you have sandalwood, you have a whole host, but lavender is a common one that you'll see in lots of skincare products because lavender oil, the natural one, is known to balance the pH of your skin, balance your good skin bacteria and kill the harmful ones. God designed it this way. But most of the lavender oil you see in these, manufactured products is actually a chemically lab-made lavender oil, not the real one. So if you're gonna get lavender oil, it's pretty expensive. And all you need per day is just a drop. One drop of lavender oil in your aloe vera is all you need, with a teaspoon of honey. And you blend it up. And you can use it to clean your skin. You put that on your skin, and then you wash it off with some lukewarm water. Your skin cleansing is that simple. No need for these expensive facial cleansers and all of these Aveeno foolishness. I stand without fear to call all these things foolishness because most of them are. Next slide I'm bringing up here is your natural skin scrubs. So there are lots of skin scrubs that you can use to exfoliate and remove excessive buildup of dead skin cells. And it's something that you maybe want to do once a month, as Trisha said, and I'm going to be agreeing with her here. And it doesn't have to be an expensive one that you buy. You can actually use a little honey, 1 teaspoon of brown sugar with 2 tablespoons of honey, and you put that together to make a little paste and massage into your skin to exfoliate gently. You can also use, for persons who have even more sensitive skin, you could use the finer grains of a baking soda along with your honey to make a skin scrub. You can also use fine Himalayan salt. Salt dries a little bit, so you don't want to be keeping salt on your skin for very long. So I tend to prefer the brown sugar or the baking soda with your honey or with your oil as a way of scrubbing your skin. And I've begun to do a little bit of those things myself, having gone to Shades of Elegance, and they taught me about how to take care of my skin, which is something that as a little country youth, I really did them thing. Just wash your face with the same soap I bathe with and just move on. And I've seen significant changes how my skin look and feel because of just doing these simple things for my skin. Natural face mask is a way now to, help give another level of cleanness to your skin and help to get moisture into your skin. And there are various homemade recipes, and I put actually 5 of them here. And my favorite are definitely going to be flaxseed honey and Greek yogurt. Greek yogurt, as some of you might know, is going to be a source of healthy bacteria. And so you're putting onto your skin additional bacteria, which is microbiome friendly, along with flaxseed, which contains that essential oils, or grounded flaxseed, which is going to contain your omega-3 and your omega-6 oils. And it's going to help to nourish and hydrate your skin. Now, this mixture, you ground flaxseed or yogurt, half a cup, and a teaspoon of honey. Mix that up, put on your skin, leave it for about 15-20 minutes, and then you wash it off with some lukewarm water. if you're above overseas, apricot, excluding the seeds. Don't put the seeds on your skin, it's very harsh. Apricot along with ripe banana, you know, and a little water blended up to make a paste can be used on your skin. And you put on this for like 10 minutes again. Strawberries, not strawberries, strawberries. I wrote that right. Annabelle didn't make that mistake. I did. She does make those mistakes. Plus egg white is another useful way to make a natural face mask to help to get your skin even looking younger and help to reduce those wrinkles. You know, the egg white is a source of protein, which actually nourishes your skin. And while proteins are large molecules, they do get absorbed into the superficial of the skin and help to make your skin integrity stronger and then nourish your skin. And of course, the last one, which is going to be one of my favorites because it contains activated charcoal, bentonite clay, both of which are going to be detoxifying your skin, pulling chemicals out of your skin that you put on from using that cocoa butter lotion and those other lotions that you buy. Of course, raw honey. Again, raw honey is going to be balancing your pH, balancing your bacteria in your skin. And of course, a drop of your favorite essential oil to kill harmful bacteria. And this is going to stay in your skin for about 10-15 minutes again, wash off. So you can actually again take a picture of this slide, guys. And these are 4 awesome facial masks that you can make at home. And you can make it in batches and keep it for long in your refrigerator to use over and over again. Now, to moisturize your skin, my favorite, of course, is aloe vera at the bottom right there. So what I do sometimes in the night is get a piece of aloe vera. I make sure to strip it off, completely get rid of the skin, wash it. Because if that thick green thing get on your skin, it's gonna itch and you're gonna be running to the bathroom to wash it off. So you get a clear piece of aloe vera into your hand middle and you massage into your skin and it actually disappears like lotion. And you can go to sleep with it on, or you can wash it up after half an hour, a couple of hours. Alternatively, you can use shea butter, which again is gonna be a challenge because so many brands are on the market and most of them are rancid and they are not high quality. But if you can get a high quality one, fine. Jojoba oil is actually awesome. Almond oil is here, but I don't recommend almond oil. Almond oil gets rancid very easily and you're going to put on your skin something that's going to be harmful. So coconut oil is a little better. Of course, it's got to be extra virgin, preferably in a dark colored bottle, not exposed to too much light, so it's not oxidized, because oxidized oils exposed to light are going to contain free radicals and are going to age your skin. They form advanced glycolation end products called ages, and those will make your skin you know, age faster. So you want to be careful there. Moving on to hair, and I'm moving quickly here so we can get to the question and answer. Hair growth is, for me, mostly genetically determined. So the amount of growth that you get out of your hair is not gonna be a whole lot as people make it out to be. You're not gonna get short African hair growing to 3 times the length, no matter how much that you use, unless you're gonna grow a locks, right? So if you're of Indian descent or you're Caucasian or you are black and you mix with some of those races that have genetically longer hair, of course, black people can get long hair. And so a lot of the hair growth that you'll get is genetic, right? And there's no way of going around that. But you can enhance it a little bit by providing the nutrients you need. And if your hair root is strong, it's more likely to grow before it breaks. And so what you want to be doing with hair growth formulas is strengthening your hair root, nourishing your hair follicles so you get the maximum genetically possible out of it. And so there are lots of different things that you can use. Among them here, our Jamaican-owned castor oil is world-renowned for its capacity to make your hair thicker and richer and grow. Use it along with a carrot oil like coconut oil and olive oil. Grapeseed oil, again, is problematic based on how it is extracted and so on. It's a lot of chemical processing. So grapeseed oil is not going to be one of my high recommendations. I prefer olive and coconut oil, of course, extra virgin in a dark bottle kept away from the sun. And again, a few drops of essential oils like rosemary, tea tree, and lavender. And tea tree is particularly renowned for killing funguses. So if you have scalp dermatitis, if you have funguses, if you have various kind of dandruff issues, the essential oils used in 1 to 3 drops, they are very strong. Don't put a whole lot onto your skin. These are strong and can damage your skin. but a couple drops into your formula will actually enhance how you smell. So they are fragrant naturally, but they help to balance the pH and help to keep your bacteria in your skin healthy, killing the bad ones and the funguses, especially the candida, which cause lots of itching and acne and scalp dermatitis. Candida is known for that. So the essential oils are going to be like your balancing, addition to whatever skincare or hair care product that you make, and you put this into a bottle and apply it to your scalp, as opposed to many of the hair care chemicals that you get, which you shouldn't apply to your scalp. These ones need to be applied to your scalp because your hair grows from the root, which is in the scalp. It doesn't, applying hair growth oil to the ends of the hair is kind of pointless. That's actually dead. So you need to be applying to the scalp itself, which is alive and from which your hair can grow. So of course I need to plug in here that your intake of nutritional healthy foods, lots of water, and your vitamins and minerals like your biotin and so on go a long way. Of course, many of us Black people have tangly, hard to handle thick hair, and so using things to kind of soften the hair, condition it helps. And Annabelle thinks that olive oil and honey, based on her experience and her research, which I can tell you that's spitting not normal. So if she said that, trust me, I don't know anything about this. It's all her. But if you think I am bright and I'm not exaggerating, that pick is on a different level. I am not in her category. So she'll sit and research these things for hours. And then I have to go and spend money to buy the ingredients, right? So olive oil and honey is a very good way to condition your hair. And you will combine both of these into a smooth mixture. You apply them to your hair, yeah, and you wash them or rinse them out with room temperature or lukewarm water, and that will help to soften your hair, makes it easier to comb out. Avocado, egg, and honey. Again, it's gonna be egg whites here that we're gonna be using, and you can blend these together, and these will both moisturize and condition and soften your hair and make the texture easier to manage. So these are very good and very healthy ways to treat your hair rather than depending on all of these head and shoulder and all of these things that are loaded with lots of chemicals. So if you're a chemical you're afraid of chemicals like me, and you don't want many things on your body that are gonna cause disease later on, these are great options. And these are by no means the only options. There are tons of options. When we research this on the internet, there are lots of people doing lots of different products with various foods and fruits and vegetables. And the reason is that, bacteria on your skin and on your scalp love food. They love healthy foods and they hate chemicals. And if you give them food, they'll be healthy and they'll make you healthy. So, this is very, very important. Hair dye. So I'm gonna shout out to one of my church sisters, Sister Orr, who called me yesterday and said, Doc, I see you doing a presentation. You have to include henna hair dye into your presentation. And so, yes, I'm paying homage to her by including it. So henna is actually a plant, which is actually in the Bible. So in the book of Songs of Solomon, henna is both a fragrant plant for perfume and a way that Solomon dyed his beard to make it beautiful. And so henna, this plant, the buds of it crushed and powdered and made into a paste, and you may add like indigo to get it black, or by itself it may actually be used as a makeup to make your skin glow. So you could use henna powder we can buy on the internet along with indigo, along with some lemon juice, a little bit of acid there to balance out the pH, and you mix it out and you can get a beautiful black healthy hair dye that you can apply to your hair, cover it with a plastic wrap for 3 to 6 hours, and then you wash it out. Of course, you're going to use a glove because your hand is going to be discolored. And this is a useful alternative to your chemical poisonous hair dyes that is on the market. Now, as with any hair care product, even natural, even aloe vera, you need to apply it to a little patch of your skin first as a test to see if you have a reaction to it, because all of us can have allergic reactions. So whatever I mentioned, even avocado, apply it to your skin, see what happens after a couple of hours. If you have no reaction, then of course you may be safer using them. So henna is one of those that you definitely want to do a little patch test first, and then you can go ahead and apply it to your skin. There's one part I want to come down heavily on here, guys, and it's something that I'm passionate about for many years, because I've heard this from many circles and I keep hearing it, and then I'm doing the research and I'm using common sense and I'm saying, okay, so here's the thing, guys. So there is this controversy, and I say controversy, about sun and skin. Okay, so what I've observed, I'm in Jamaica, right? And it's a sunny country, and you would expect that based on how people say sun damage your skin, you would have a preponderance of skin cancers. And in fact, in my 20 years of being a doctor, and I'm not a skin doctor, but I've probably seen 2 skin cancer cases. We look at the research across the world. Most skin cancers occur in temperate areas. That's North America, which have very little sun, and close to the equator in South America and Africa have the least amount of skin cancers. So where you have the most sun, have least skin cancers. And there are different things. It's a little more nuanced than that. But what I've seen on the converse is that most people in Jamaica and the US are vitamin D deficient. And it says a couple of things. One, right, the people who get in the least sun have more skin cancers. And the people in where the sun is hottest have low vitamin D, suggesting that, one, people in Jamaica don't get enough sun. So to recommend that you hide from the sun doesn't make any sense for your health. Your vitamin D is the most important vitamin in your body. It's the only vitamin you make because God thought it was so important he couldn't leave it up to your diet. Every cell in your body, including your skin cells, have vitamin D receptors. They control your nerves, they control your genes. 600 genes in your body is controlled by vitamin D. And when I test vitamin D levels, most people are low. I cannot, with common sense, recommend that you hide from the sun. People need more sun. Now, I'm not saying that getting too much sun to the point where your skin get burnt, like you come from Australia and you go into the sun and you lie for hours in the sun with no clothes on and you get your skin darkened. That's excessive. But that's not what's happening in Jamaica. Most people don't get enough sun. So my recommendation is to get more sun. My recommendation is to never, ever, ever put sunblock on your skin. And I will stand up to anybody with the research and show you why this is a bad idea, right? To block out rays of the sun that are going to be helpful for your skin, putting on chemicals on your skin to protect you from what God made for you. This is counter to everything that I have learned that makes sense to me. Trisha, sorry, we can debate it, but I will never use sunblock. I'll never recommend it. I don't see the point of it. If you hydrate your skin, drink enough water, put on the right nutrients on your skin, and you get enough sunlight, maybe 3 to 4 hours a day, you will be just fine. Look in Jamaica, look at our farmers, look at our people who work in the market, guys who work on the road. I'm really not seeing this chemical sunblock thing, and I will forever stand up and say, guys, this is one recommendation I strongly disagree with, and we can debate it. And Trisha here, I say, is the skincare specialist. I am not, but it makes no sense to me to put chemical on my skin to protect me from what God made to make me healthy. I love the sun, and I'll go in the sun every chance I get. And I recommend that people who are white get at least 20 minutes per day. If you're black, at least 90 minutes per day to make the most important vitamin that your body needs, vitamin D. Most of us, and I do the tests day in, day out, and most of us are vitamin D deficient, and we have weak immune systems, higher cancer rates, more viral infection. Most people died in COVID because they didn't have enough vitamin D. I'm very passionate about this, and the research backs me up. Do not use sunblock. Go in the sun, get enough water. Do not overexpose yourself, but you need sunlight, and stop putting poisonous chemicals on your skin. I hope I didn't overdo it. And I think I'm going to end there and turn over back to Dr. Hibbert.
All right. Thank you so much, Dr. Thomas. That was a mouthful, but very, very educational. Also, thank you so much. Extend our appreciation to Annabelle, of course, for her part in your presentation. And just to say, we will definitely have to organize that debate. I don't know, Tamara, if you can do that. I would love to hear from each side, the
Yeah, we'll work
research
on it. We'll work
that
on it. Doc.
supports it. Sorry, Tamara, say again.
So yeah, we'll work on planning the debate.
Yes, yes, yes. We will have to do that because it sounds very, very interesting. Very interesting. All right, so we're going to move quickly into our question and answer segment. I'm going to start with the questions that I see in the chat. These, I believe, were for Trisha. So I'm going to just read it out for you, Trisha, and you can answer. What if you have, this is from Nadine, what if you have sensitive skin? Which exfoliation is best? And part B, what are your thoughts on using body moisturizer on your face versus facial moisturizer?
All right, so I have a big smile on my face. Thank you, Dr. Thomas, for that insightful presentation. We're really not far apart. We're up the same street. We're just up the same street, but just not up the same street with the latter part. But I guess our administrators will set up a debate for us. All right, so to answer the question, and I do love you. You know I love you already. But to answer your question, we finish. But to answer the question is, sensitive skin. Dr. Thomas mentioned it, and I didn't mention any of these on my presentation because I know Dr. Thomas would have been presenting on these things. So hence I didn't put those on my presentation. So for the sensitive skin, we can use the sugar. We can use the brown sugar for home recommendation. And there are some products on the line, on the market, that are not as harmful. And I agree with Dr. Thomas. There's this product line that I work with, and I've been working with it for years, maybe about 8 years now, and that's the Southeast brand. It causes no irritation. It's all natural. The ingredients are grown in their own farm. I've seen the farm. In fact, I'm supposed to be going to France next year to get a tour of the farm and to see how the products are manufactured and stuff like that. But yes, we can use the brown sugar and the honey. That's very good for the sensitive skin persons. As it relates to body moisturizers, no, we wouldn't recommend. And one of the things I wanted to understand is when we go outside, when we leave out of our house and we step outside, the first place that hits the sun is our face. Dr. Thomas mentioned that the sunblock is not necessary. I agree with you that we need sun, we need vitamin D, and I am a living testament of that. And you know that. But also, the sun causes our skin to be dehydrated. And if it is that we are going to be, treating our skin, we have to protect. So I wouldn't recommend that you put the skin moisturizer that has all the perfumes and as I said, I agree with Dr. Thomas as it relates to the moisturizers and the perfume stuff that we use on our body. I don't recommend those any at all. And I strongly recommend the jojoba oils, the cocoa butter, the shea butter, and stuff like that on our body, especially at nights. I do recommend those stuff, but not the lotions that you use on your skin. You're gonna be using it on your face. We need to separate.
All right, excellent. Thank you so much for that answer. I'm going to open the floor as well to all the persons who are on Zoom now. If you do want to ask a question, just raise your hand and we will get to you. But before we do that, I have some questions from YouTube.
Yeah, there are 2 questions there. I can support you with that if you like, Dr. Hibbert, for the YouTube questions.
Sure. I actually have them in front of me.
Perfect. That's
For
okay.
Vereen Mills, I'm going to ask you to just provide a little more context for me, Vereen, but I'll read out the question to Trisha and Dr. Thomas. It says, "Good night, everyone. What about someone with vitiligo on the face?" So if Vereen could give me a little more context on that so that I can answer the question appropriately, I'd appreciate that. So while she does that, I'm going to move on to the next question, which says, "Do you recommend vitamin D supplements?"
Okay, so that would
100%. Oh, okay. You go ahead, Dr. Thomas.
okay, sorry, Trisha. Yeah, so vitamin D supplements are gonna be high on my list of recommendations. This may be now the number one or number two supplement that I recommend, given what I'm seeing across our population, that we're vitamin D deficient and how essential it is. I recommend one of two regimens. I recommend 5,000 units once a day, or I recommend what I take, which is 50,000 units once a week. That's a little more convenient for me. And, I do test my vitamin D levels once a year. There is theoretically a risk of taking too much and getting vitamin D toxicity. I've never seen it in my life, to be honest, but theoretically say it's possible. But most persons that I test are usually just barely normal or low. And I recommend that your level should be like between 40 to 100. Most persons are registering 20s and 30s. So vitamin D supplementation is absolutely essential for most persons unless they work outside. If you have an office job, if you are indoors most of the time, if you're afraid of the sun, then vitamin D supplementation is going to be essential.
And I must add to Dr. Thomas that vitamin D supplication also helps with your mood and how you feel and stuff like that. So we 100% recommend vitamin D.
Can you tell us, Dr. Thomas, where we can get some of these vitamin D supplements in the doses that you mentioned before?
All right, so let's also say that most vitamin D supplements on the market are gonna be like 400 IUs, 1,000, 2,000, which are inadequate for everybody except for kids. So you need to be getting 5,000 to 50,000. So in most pharmacies, they'll have 5,000. Pharmacies and health food stores especially will have 50,000 occasionally. You can get them if you're in my area. Of course, that's Stone's Wellness Pharmacy. I know a couple pharmacies in Old Harbor that know I prescribe it and started stocking it now. You can buy on Amazon if you're overseas. And of course, you could go to my website. Go to my website at www.drorlandothomas.com and scroll to my shop. You'll have vitamin D there with K2. And K2 is an important component that ensures that the calcium you absorb goes to your bones and not to your arteries to cause calcification. So vitamin D really should be taken with vitamin K2 for that benefit. So my website, or no, don't go Amazon, go to my website. Not giving Just Bezos no more money. I want to get rich too.
All right. Thank you, Dr. Thomas. Another question from YouTube from Patrice Burton says, "I heard that lavender oil and tea tree oil disrupt your hormones. Is that true?"
Yeah, so lavender oil and tea tree oil can have hormone disrupting properties if they are used in excessive amounts. So the amounts you use is gonna be what's key here. Just like any medicine, Dr. Hibbert, you'll know the difference between a medicine and a poison is dosage. So Panadol can kill you if you take too much. An antibiotic that we use to treat an infection can be harmful if you take too much. And so lavender and tea tree oil and any essential oils are super strong. They are very, very, very easy to get into gaseous form and they smell like the whole place. So when you're using these things on your skin, in your formula for one application should be 1 to 2 drops the most and not a teaspoon. If you do a teaspoon, you're gonna be causing a whole host of problems because they're so potent. So the dosage is what's important. If you get the right dose, then you're fine.
Okay. All right. Excellent. One last one that I'm seeing here from YouTube. Inga is asking if there's a particular brand of vitamin D that you recommend.
Vitamin D is one of those vitamins that most brands are pretty good. My preferred brand is from a company called Ortho Molecular Products. So ORTHO molecular products. And on my website, you'll find an additional brand, which I have tested myself over and over again, called Live Good, vitamin D plus K2. That's a very pure brand that has a K2 in it. So those are my two top brands that I recommend, Automolecular Products or Live Good.
All right, wonderful. And Vereen has clarified the question. She is asking, should someone with vitiligo use those moisturizers on the skin? And she mentions that she also uses the Simple brand soap to wash her face. I think that question may be for Trisha.
All right, so and I'm still gonna ask Dr. Thomas to assist me with that question because vitiligo is a skin condition, and I think that it's an autoimmune as well. So for vitiligo, I wouldn't recommend anything that is harsh. I would more recommend natural products to assist with that skin condition. Vitiligo is the reducing of the pigmentation of the skin where the skin gets whiter in patches. So if it is that the condition can be corrected on its own, managed, it also increased by stress as well. So if it is that we manage our stress, then it can be minimized, but products will not get rid of it. What will happen is that once it is minimized, the pigmentation will come back to normal on its own. So I would more recommend that they use the aloe veras and the natural products that will cleanse the skin. Like Dr. Thomas mentioned that you can use a little of the jojoba oil and stuff to wash. I don't have a problem using those things to wash your face at home, not at all. So I wouldn't use any strong chemical or harsh. In fact, I don't recommend any strong chemical or harsh products on the skin. In fact, even on our scalp, we use the sulfate-free shampoos because we don't want to use the sulfate on the hair and scalp to dry out. So that is where we're going now. So we wouldn't recommend anything harsh on the skin.
All right, yeah, so definitely agree with Trisha there. So vitiligo is, as Trisha rightly said, the autoimmune destruction of the melanocytes, which are the cells in the skin that produce the dark complexion. And so that's more internal, that's more immune system issue. It's not really, gonna respond much to putting things on the skin. In fact, there are not many great treatments of vitiligo for that matter. And so you treat vitiligo skin, like a sensitive skin. You treat it with just mild chemicals. You cleanse, moisturize, and so on. So don't try to use anything to get back the skin color. That's not going to happen. It might just do more damage. So just very careful.
All right. Thanks, Dr. Thomas.
All right, we have one more question from Elaine Jennings McCullough, who is asking, is homemade avocado oil recommended?
Yes.
Yeah,
Recommended
man.
for, okay, go ahead, Dr. Thomas. I was going to
No,
ask
man, go ahead.
recommended
You go
for
ahead,
what?
You
I was
go
going to
ahead.
ask recommended for what? Is it for your hair? Is it for your skin? But yes, if it is homemade avocado oil, because avocado, as we said, Dr. Thomas and I alluded to the fact that it is an excellent product for the skin and the hair. So yes, you can go ahead and create your own avocado oil and use it. It can be used on your skin. It can be used on your hair. Can be used wherever you want to use it on the body.
Yep, 100%. Endorse that. Nothing more to add.
Right. Marie Ingram is asking, what can I use to thicken my hair? It's very thin.
All right, I want to take that question. As Dr. Thomas mentioned it in his presentation, and you realize that I was clapping him away. Genetically, if you are born with your hair thin, there's nothing you can do to get it thicker than the norm. No matter what you use, If it's genetics, you will have to work with that thin hair. Oftentimes, persons want to use something that will get the hair thick. Nothing that you use can get it thick. You can use volumizing products that will volumize the shaft, but the hair will not grow thicker than what you are born with. Also, if it is that the hair is thinning as a result of a hormonal issue or a dietary issue, remember, if you have low iron issue, the hair will be thinner than the norm. So it will result in diffuse hair loss or telogen effluvium. So that person would need us to look at the reason why the hair is thinning. Has it been thinning? Has it been thin since you were born or since a year ago? If it's since a year ago it has been thinning, then something is definitely wrong that we need to look into.
All right, so I want to also add, yes, Trisha, same kind of part. There are a number of different conditions that might cause in here, Marie. So there are a number of diseases such as hypothyroidism, there is stress, there is deficiencies in a whole host of nutrients, iron being one, but various vitamins like vitamin D and even vitamin E and vitamin A, all of these different deficiencies in different chemicals and different nutrients. And there are medications that might cause your hair to be thin, medications for autoimmune diseases and steroids and so on that may cause hair thinning. So the treatment is gonna be, based on what your cause is. So we need to figure out, and if it's stress, Marie, you know me know you. So if it's a recent issue and it's stress related, then, maybe we need to try and address that, looking at, how you manage the stress, your sleep pattern, your exercise, just, your thought process. A lot of these things over time, if they are the cause and you correct them, they're gonna improve. But it's kind of, a waste of time to say, okay, I'm deficient in vitamin A and I'm a hairy thin because of that, and I'm gonna go to the hairdresser to get some chemical or some treatment to get my hair thick. That's kind of ignoring the underlying cause. And functional medicine really is on the basis of understanding what's causing it and then addressing that. So yeah, I think Mary did have pretty thick hair at one point, so may not be genetic. So if you hear everything on Mary, then we need to figure out exactly what's going on.
And also, Dr. Thomas, if I may add, we can look at her age as well, because it can be an hormonal issue where maybe she's going into menopause. We don't know. We don't know. Because remember that with age too, the cells deplete. And with menopausal changes, the hair can shrink, the follicles can shrink, and then we start having the telogen effluvium. So it's a lot of different things that we would need to look at to figure out that problem. It can't be just a yes and no answer on this platform tonight. It definitely needs a consultation for us to see and decide. And that's the reason why it is very important that you have your trichologist and you have your doctor, because the trichologist works alongside the doctor, because we are not doctors. We don't diagnose. But once you come in and we do the necessary consultation, then we communicate with the doctor, send you to do the different tests, because we can't send you to do the different nutrients, the tests of the lack of vitamins and the iron. Only the doctor alone can send you to get those tests done. And, we have sent clients to the doctor to get most of these tests done to find out what is the underlying cause of, hair loss and stuff like that.
On that note, Trisha, I'm just going to ask you to repeat your details for me. Somebody on YouTube, Mrs. Bernard Stevens, was asking for the details for the presenter in terms of where you're located.
All right, so the company's name is Shades of Elegance Limited, and we are located at 36A South Street, Old Harbor, St. Catherine, and our number is 983-6652 or 361-3043. We also have our website that you can visit at www.theshadesofeleganceja.com.
All right, excellent.
What we can do is ask Dr. Thomas to post the information on the feed so that persons can see the information, if that is okay.
Yeah, man. Tamara can go ahead and do that. Yeah, Tamara could just put that in the chat and then so on. So yeah, but so Stephanie Bernard Stevens,
Dr.
you know
Thomas,
where the elegant is?
Dr. Thomas, if you don't mind, I'm gonna run.
Yes.
Is that okay?
Yes. We're
All right.
almost done. So that's it. Thank you so much.
Thank you very
Dr.
much for
Hibbert,
having
want to
me.
give you her vote of thanks. Just give Dr. Hibbert a chance
Okay.
to just say thanks to the
I'll wait.
officials.
I'll wait for the vote of thanks. I'll wait.
Go ahead, Dr. Hibbert.
Okay. All right. Okay, we can take a couple more questions.
She have to run.
I have to
No,
run.
I'll take
Okay,
them.
all
I have to
right.
run. Dr. Thomas can take the question, but someone has been waiting for me for the longest
Okay, no
time.
problem, no problem, no problem. All right, thank you so much, Trisha. We appreciate you being on this platform just to educate us about our hair, skin, scalp. It's been wonderful, and we just look forward to having you on many more seminars. So all
Remember,
the
I'm a
best,
part
and
of the
thanks
family,
again.
so remember, I'm a part of the family, so use me up.
Yes, yes, absolutely.
Okay. All right. So I have to run, guys. What they can do, they can call and I'll answer the questions.
Okay.
It's fine if they call, I'll just answer the questions once they call. We'll be open tomorrow, but we won't open on Monday, but business back to regular on Tuesday. So they can call and I can answer all the questions. All right.
Okay.
All right.
All
Thank
right,
you.
no
Have a
problem.
great
Thank you so
evening.
much.
Okay.
All right. So Dr. Thomas, I guess we'll answer the other two questions that are in the chat. One is, are there any homemade remedies for facial warts?
Yeah, so facial warts are, just abnormal growths on the skin that is gonna need professional treatment. I can't think of any effective homemade remedies that I can say has worked consistently well. So if you have warts, you need to visit Trisha and she will assist. She does wart treatment. It's not something that I do professionally, but Trisha is the person I refer my clients to get your warts removed. So you need professional help there. But many warts people are gonna be genetic that occur on the face and neck, and you remove some, and by next year a lot will grow back. So it's something that you might have to do multiple times, as it is commonly genetic, most of the warts that we treat. And so yeah, you need professional help there. Nothing homemade that is going to be very effective.
And our final question for the night says, can you recommend a moisturizer and a shampoo for a 3-year-old?
Moisturizer and a shampoo for a 3-year-old. Yeah, so well, typically for that age group, we're gonna be recommending things that are hypoallergenic and don't have a lot of fragrance in them. So a shampoo is gonna be fall in the category. Again, it depends. For me, I'm seeing children who may have funguses in their scalp, who may have eczemas and so on. So I'm recommending things like your Selsun Blue shampoo. That's a pretty child-friendly one that's in most pharmacies, Selsun Blue. Sometimes recommending Cetaphil does have a shampoo, and that's pretty hypoallergenic, and they have skin moisturizers and so on. Also, I do recommend the Keto Plus or Keto Conazole shampoos, and these are really for kids who have lots of eczemas and itching in the scalp and lots of excessive buildup of dandruff. So these might help to clear those things from the scalp. So those used to treat a particular condition, might be helpful. But the natural products that were recommended earlier to clean your scalp and face and to moisturize is also applicable for kids. So help your kids to develop healthy, natural routines from early, and so they'll keep these habits into adulthood.
Thank you so much, Dr. Thomas. All right, our time was well spent. We learned a lot. and now we have to process it all. So I just want to thank all thank the speakers, of course. Thanks to Trisha again, and thank you, Dr. Thomas, for educating us. And of course, thank you to all the persons who joined on YouTube and on Zoom to really just make this productive and engaging session. I am just going to close in a quick word of prayer as we go. So, Lord, we thank you for our time well spent, and we pray that you will just help us to do good with this information. We pray that you will continue to bless the speakers as they seek to educate and as they use their passion to make others' lives well and blessed, Lord. We thank you once more for this series, and we pray that you will just continue to bless it as we go throughout the rest of the year. In Jesus' name we pray. Amen.
And before you guys go, whenever you call Thomas Medical Center or come there, Dr. Thomas is not available. This beautiful lady who has been our host is a doctor that you'll see. So don't be shy if I'm not there, I'm sick or I'm tired. We have an excellent physician that will be helping me and has been helping me for over a year to take care of all of you guys. So this is Dr. Hibbert. For those of you who have not yet met her, please come to Thomas Medical Center, even if I am not there.
Agreed.
All right. Good night, everybody. Take care.
All right. Good night.
We went over to where we went that time for that Mediterranean place in Fairfax. Yeah. I know where you're talking. You know where I'm talking about? Yeah. Townhouse. Really? Oh. Guess how much? $1 million. What? $1 million. I would have never thought that.
So, Jared, I would have talking in the background. I've heard that.
Oh no, it's Cheryl. It's my daughter.
Okay.
I'm trying.
Hi, Cheryl.
Oh, okay. Hi, Cheryl. Dr. Thomas said hi, Cheryl. Oh, he's right here. Say hi. Oh, Cheryl said hi.
Okay, it's nice to have you guys on. Thanks for joining.
All right, Dr. T. Talk to you.
Yeah, man.
All right, bye-bye.